Good morning. And before we get started, I want to recognize our Vice Mayor, Bill Wright, and Council Member Sterling Wilder. Don't see any other council members here. No, thank you. And thank you all for joining us. The purpose of calling you here for this press conference this morning is to bring to the public's attention the growing number of COVID-19 cases in the Central Virginia area, and to ask the public's assistance in stemming the tide of this virus. In speaking to our healthcare community, we felt that it was very critical that we bring to the public's attention this growing issue. Joining us today are Dr. Chris Lewis, Vice President of Medical Affairs, Centra, and Dr. Carrie Gately, Director of the Central Virginia Health District. After their comments, we will open the floor to questions, and I'd like to have Dr. Lewis come up right now and make his comments. Thank you.
All right, thank you all. Thank you, Ms. Mayor. So as I was introduced, I'm the Vice President of Medical Affairs for Centra Health. And I've been asked to say a few words about Centra's perspective, or what we've seen within the community and in our hospital walls since the pandemic began. And I wish I could bring you good news, but I can't. And this is quite serious, and I'll give you some numbers and some thoughts to try and help convey that. So as the mayor had already mentioned, and I think Dr. Gately will reaffirm, we have seen increasing numbers of individuals within the community testing positive for COVID. In the beginning of the pandemic, we were seeing at Centra on the order of single digits, 1, 2, 3 patients or individuals, a day testing positive for COVID. That number has recently drastically increased. We are seeing on the order of 30 plus individuals testing positive for COVID, and that number continues to increase. The importance of that is that a certain fraction of those individuals will get sick with COVID and sick enough to need to come into the hospital. Therefore, we are seeing numbers that are increasing both on the floor and in the ICU at Lynchburg General that are correlating with this rapid increase. As of today, in the hospital, we have 36 COVID positive patients in total. That is the highest number we've seen to date. And as I said, it continues to increase. Of those 36, 20 are on the floor, 16 are in our ICUs, critically ill. Of those 16, 12 are on a ventilator. If you've been tracking those numbers through our press conferences, you'll notice that those are all increasing. And I need to also share that there's additional information behind that we actually on Friday began to move some patients towards Farmville, our Farmville hospital, that were COVID positive, as we were seeing high numbers at Lynchburg General. And frankly, our numbers in our Farmville facility had dropped. And we were actually, for a moment, down to 0 COVID positive patients in our Farmville location. As you may also recall, at the beginning of the pandemic, our Farmville Southside Hospital was more stressed with COVID, with ICE facilities, jails, and congregate settings there having significant outbreaks. We were able to help, since Centra is a system-wide organization, able to help that facility, the Farmville Hospital facility, initially by taking on some of their COVID patients and helping care for them here in Lynchburg. The reverse then became true, and so we have moved some patients over there safely to be cared for. That's just simply an example of all the levers we are trying to pull to maintain the ability to care for our community here in Lynchburg, and it's becoming increasingly challenging. If you look at our COVID numbers, you'll see that we have a total of 49 ICU beds at Lynchburg General. Currently, we are dedicating nearly half of all our ICU beds for the treatment of COVID critically ill patients, and the number continues to increase. That trend is simply not sustainable, because we need to be able to take care of our community with COVID, but also our routine patients who also need general care. The numbers will not work if this trend continues. Part of the problem is that we see patients increasingly coming into the hospital And with COVID, we are seeing very long lengths of stay, meaning that once folks come in, it takes a long time to be able to heal them up and discharge them. So, to the point of our average length of stay on the floor, if you never make it into the ICU, is 6 days. That's fairly long for a hospital stay. But I will tell you, if you get into the ICU and need to be on a ventilator, that average length of stay at Lynchburg General is currently 20 days. That's average. That is how sick these folks are. If you continue to have patients come in and you can't discharge them, that equation eventually breaks down and you can't continue to care for patients the way you need to. It's hard to, I think, express fully how sick COVID can make individuals and can make any individual. One of our sickest patients with COVID passed away this weekend. That patient has my age, is identical to me in age. Now, I think it depends probably on who you are, whether you think that is old or not, but I don't think so, personally. And I could have been in that bed, and I could be not here speaking to you today because COVID had killed me. This can affect everybody. What I also need to say, it's not all negative and all bad, and I want to end on somewhat of a more positive note. I will say that we at the hospital have figured out how to best protect ourselves and our patients from COVID. We had to do this at the very beginning of the outbreak. We quickly realized that we had to essentially treat and see every patient as possibly being COVID positive, not just the ones that were coming in sick with cough and shortness of breath and fevers, but it could have been the patient that came in with an ankle fracture who happened to also have COVID. If we did not protect our caregivers with masking, proper behaviors with hand washing, they would have been much more at risk and exposed to potentially getting COVID. This then, frankly, quickly translated to, well, we need to actually mask everybody in the hospital because we could see the potential for contracting COVID from one of our fellow caregivers. Now that COVID is out in the community the way it is, we doubly need to do this. Certainly within the hospital, everybody wears a mask. That's how we're protecting ourselves. We see everybody, including our fellow caregivers, as potentially having COVID. And this is not a judgment call. This is not a they are bad people. This is just simply the reality of COVID. So what we would suggest is that the public outside our walls behaves very similarly. This is what we learned in the hospital. We suggest you take it to heart outside the hospital. If you leave your place of dwelling, you need to consider potentially everyone you come into contact as possibly having COVID. It is that widespread in our community. That means masking, avoiding congregating in close quarters with multiple people. Frankly, at the hospital, we do not hold meetings anymore the way we used to. We are virtual. There are pros and cons to that, but for safety, we have had to do that. We would suggest outside in the community setting, you do the same and try not to congregate as much as possible. And when you do, please socially distance while wearing a mask. And then finally, the humble hand washing. From the start, this is something that we know we've had to practice. Hand washing stations are throughout the hospital. I see them popping up across the city. Please use them. It's the way you'll protect each other, will protect this community, and frankly, protect your family and your friends. Because when you go back home, you're not going to be wearing a mask. We understand that. But you don't want to be bringing this back to your dwelling either. All right, thank you very much.
Thank you. Dr. Gately, would you like?
Good morning. I'm Dr. Kerry Gately. I am the health officer for the Central Virginia Health District and the West Piedmont Health Districts for the Virginia Department of Health. This morning, we are reporting on the VDH website 1,122 cases of COVID-19 in the Central Virginia Health District. We went over 1,000, I think, Friday, perhaps Saturday. Unfortunately, the system did not update. We had some problems with our tracking system over the weekend, but now I think we're up to date today. We had our first case March 21st of this year. So we have gone from 1 to over 1,100 in this period of time. Each one of those cases, as we receive it in our automated system, our laboratory reporting system, requires follow-up on the part of myself and my staff. What that means is case investigation. So each one of those 1,122 cases, we have to investigate, we have to try to make contact with, we try to find out what's going on with that individual, what has gone on with that individual, and who he or she might have exposed to the virus while in an infectious phase. That's a lot of work. We have, up until recently, been doing that ourselves, nursing staff, environmental health staff, clerical staff, everyone that I could find within the health department. Fortunately, we've been able to add contract case investigators recently, and their number is increasing. The same is true for our contact investigators, because every time we do one of those case investigations, we end up with a list of contacts, people who might have been exposed. In that situation, we have to try to contact all the contacts and make sure that they are sufficiently quarantined so that if they in turn develop illness, they will not be exposing others. So it's case investigation with isolation, it's contact tracing with quarantine. I finally have enough workers that we're able to do that, and it's a good thing too. Because of those over 1,100 cases, I have 300 of them have come in the past week. We are breaking records at the health department for the number of cases each day that we are seeing. So I have those case investigators calling and calling and calling, more and more of them calling. I have those contact tracers making more and more calls. But that isolation and quarantining system, which is all we've got right now as far as controlling the spread of SARS-CoV-2, won't work unless people work with us. So I say we have had a lot of great folks that we have called, and they have been right with us, and they listened to us, and we've helped arrange their isolation and explain what's going on and what they need to do. Increasingly, though, people aren't answering the phone. We're increasingly having trouble getting in touch with people. I don't know if that's because the cell phones that our case investigators are using are issued from Richmond and have 804 area codes, or what it might be. But we're just seeing some difficulty in reaching a lot of folks. We try 3 times and then we end up sending a letter. That's very unsatisfactory. That takes too much time, and all that time that individual might be infectious and might be out potentially exposing other people. The same is true for the contacts. Sometimes we're having a bit of difficulty with our case investigators as far as people being forthcoming with whom they've been in contact with who they might have exposed. We have some people that amazingly just don't know anybody. I want to encourage everyone, to the extent that you are able, to work with us in the isolation, work with us in the contact tracing, work with us in the quarantine. We know that it's difficult. I mean, we're the health department. We're used to the fact that when we call, it's never good news. And we can appreciate that you don't want to hear from us because it's going to be isolation, it's going to be quarantine, it's going to be something that's not going to be fun, it's going to be very inconvenient, and something very difficult to do. But that's what we have. That's what we have to control the spread of this virus. What are we seeing when we do our case investigations? Well, unfortunately, we're seeing everything. We're seeing every sign of a sustained community-based transmission of this virus. Well, what do I mean by that? Well, yes, we do have some workplace outbreaks. We have some long-term care facility outbreaks. We have some family-based outbreaks that are probably the result of travel, when more individuals there. And we're starting to get a number of cases that have no idea where they might have gotten exposed. And one of the common things that we will hear is, I was being careful. Well, that's good for you to be careful and you to take all the procedures that you can, but if the people around you are not being careful, then that puts you at risk. Remember, these masks are considered source control, meaning they're most effective in keeping you from infecting someone else. They have some use perhaps in keeping you from becoming infected. The main thing is to keep you from infecting someone else. So this person over here may be very careful to wear the mask and observe the social distancing, but if I'm not careful, then I'm putting that careful person at risk. And so I think people need to think about that and the motivations behind the masks, the social distancing, even the hand washing, everything that we're doing. We have to work on this probably for a pretty long time. And frankly, this is uncomfortable. I don't like this any more than anybody else, but I feel like I have a responsibility to be careful for other people's sake. And that's what I would encourage all of you to do. We're also showing 56 hospitalizations as of this morning. There was a glitch in that system, and I do want to express my appreciation to Centra Health for helping us finally work that out. We finally had to ditch the old system we were using and work with Centra to come up with another that will work better. So those numbers should be good. We are seeing an age skew in the distribution of our cases, meaning the age of our cases is sliding or skewed toward the younger. And the age group 20 to 29 is our predominant age group right now for the number of cases. One of the things that I like to do is compare what's going on in Central Virginia Health District with what goes on in West Piedmont Health District, which is Franklin County, Henry County, Patrick County, Martinsville. Their age distribution is slanted toward the age 50 to 56. Their hospitalizations are at least twice ours. Their population is half. So from place to place, from district to district, from county to county, I'm seeing different things going on all over. But the common denominator is that we all have to be careful. We all have to engage in the social distancing. We all have to use the mask. We all have to be careful about congregating. We have to be careful about going out and where that it is we are going. To echo, I think what Dr. Lewis was saying, the thing that people have trouble with this virus, the thing that people seem to have difficulty grasping, is that you can have anything, any manifestation from nothing to extremely serious illness, intubation, being on a ventilator for 20 days. I have read studies that probably, and it's a pretty wide range, but let's say up to 40% of individuals infected with SARS-CoV-2 who are COVID positive may be asymptomatic or may be minimally symptomatic. In other words, that person has been exposed, that person has developed infection, that person is shedding, probably a bit lower load of virus, but still shedding the virus and not knowing it. That's the person especially for whom the mask is important and for whom the social distancing is important. But I feel fine. I hear that a lot. But I feel fine. Or I felt fine, even as I'm calling you to tell you that you are COVID-19 positive. So the virus is tricky, and as I have said before, the virus loves a crowd. I encourage everyone to think from the perspective, if you will, personifying it, think from the perspective of the virus. The virus wants to spread, the virus wants to propagate. What are the best ways for it to do that? That's for people to be close together, coughing, sneezing, breathing, talking loudly on each other. As you decrease the source, as you increase the distance that the virus has to traverse, as you decrease the amount of time that you're spending in that situation, for example, it makes it less and less possible for the virus to transmit. Clearly, we're not doing that very well based on the number of cases that I have seen in this past week. So, once again, I lay those numbers, I lay that evidence in front of you and ask everybody to consider it very carefully. Thank you.
Thank you, Dr. Gately. That's stunning information, and thank you for giving it to us so succinctly. Before we open the floor to questions, I just want to reiterate one more time that it is critical that everyone take heed to the advice of Dr. Lewis and Dr. Gately. By now, many of us have been touched by COVID, and perhaps we even know someone who has succumbed to it. And some people who have recovered, have been lucky enough to recover. I ask that you follow the advice of these two medical professionals and other medical experts. Wear a mask, wash your hands, social distance, and stay home whenever possible. This is just a minor inconvenience when you take into consideration all the lives that you are protecting and possibly saving. We have the power to slow this virus. I'm just going to say it one more time. We have the power to slow this virus. Be smart, Lynchburg. Let's mask up and be Lynchburg strong. And now I'd like to open up for questions for Dr. Lewis and Dr. Gately. Are there any questions?
Dr. Lewis, there are those who still compare the virus to the flu. They still have the debate that so much has not been done for the flu versus COVID. Schools are being shut down, so forth and so on. How would you respond to those?
So, and thank you, we've certainly heard that. This is a different thing. This is behaving differently. This is infecting us at a different rate than the flu. Humans haven't seen this virus. We just haven't seen it yet. We've seen variations of the flu. This is new. And that's why it is spreading so drastically, because we have no immunity to it. And what it is doing to us in terms of how sick it makes us is different. The flu doesn't pile people into the ICUs like this does. This is, maybe if this still is around in several years, we could say, well, maybe it's more like the flu. Right now, this is not the flu. So please behave accordingly.
Dr. Lewis, I imagine there are patients in your ICU who are not COVID positive. What are you doing to protect them from the COVID positive ICU patients?
Great, Santiago, great question. We've had to be, from the very beginning, very mindful of protecting our patients that do not have COVID from those that have COVID or suspected. Currently, we have 2 full ICUs that are dedicated just to COVID patients. There are no others there. The staff behaves very differently. We consider these hot zones, essentially. They will go in a sort of ritual of gowning up and doing all the PPE. They go into these units, they stay in these units until their shift is over and come back out. It's a different process. So we don't want it to spread any further into the hospital. And I'll piggyback onto that. The question, I think, the mention of the masks are uncomfortable, right? Yeah, they can be. I understand that. But I would like you to realize that the caregivers at Centra who are in these COVID units, either in the ICUs or on the floor, they're in full PPE all day long or all night long. That's what it takes for them to be safe and for care for the community. So I don't personally have a problem wearing a mask. I've seen what it looks like, what they go through. If they can do that, I can do this.
And a question for Dr. Gately. Something that people often comment when we report out these numbers is asking, well, what about the people who have recovered? So the 1,100 figure that you mentioned, does that include patients who previously tested positive and then recovered and tested negative, or is that just the active positive cases?
The best way to think of that 1,122 number is that's the number of unique positive tests for COVID that we have received. So if you are positive and you submit the test, we do our case investigation, and for some reason subsequently you're tested again, we match that up in our system and you're not counted twice. So You think of it as the number of positive COVID tests for unique individuals that we receive.
But if a person has since tested negative after testing positive, are they removed from that count?
No, they're not. That is a cumulative count.
Okay.
Okay, I'll go. Several questions. One is with the 30 people increase, especially last Friday, we saw 33 people. I guess Dr. Lewis, you can answer this. Are staff at the hospital, are they overwhelmed?
Are we overwhelmed? We are stressed about as far as we can go right now. And I would say that's staff. I would say that's bed capacity. It's across the board. You know, I think, are we managing currently? Yes, but barely. The fear we have is that we're worried about what's down the road because we've seen the increase in cases in the community. We know that what that's going to translate into more patients coming in, more patients in the ICU. So again, that's why I don't have good news to come here. What happens next, we'll have to see. But you know, it's going to strain our capacity to take care of our patients, COVID and non-COVID.
And then, so for the folks that you're seeing that are, I think you said 20 to 29, that age group that's testing positive, when it comes to contact tracing, are you finding common interest in those? Are these people hanging around the same place? Like, what are you finding out about this particular age group?
Well, for the 20 to 29 age group, I think one of the most interesting things we found on case investigation is sort of this feeling as we're talking with them that they knew that this wasn't a good idea. Going to a gathering or going out and hanging out with a group of their peers. But unfortunately, the other sense that I get from them is, well, I'm young and it's not going to be much anyway. You know, it's really not that much of an issue for me because it's the older people who are at most risk for the serious consequences. Okay, there's something of a point there. But when I'm hearing that, the way that I'm responding is basically, yeah, you will probably be okay. But you don't have a guarantee that you won't be the one younger person who has a bad interaction with this virus. And B, you're infectious. Okay, well, it may not matter to you if you infect your 20-something friends. But what about parents? What about aunts and uncles? What about grandparents? What about other people in your social circle who may be more vulnerable to this virus? Even a little bit older with diabetes, for example, who may be at increased risk of a bad outcome if they get infected. So once again, it's like, that's good for you. You're 20, 29, you're probably at low risk of bad disease. Good for you, but what about the people around you?
And when it comes to making sure these people, or just everyone that you're reporting on, stays in quarantine, how do you make sure that these people are not going out still into the community? Are there repercussions for that?
We do the best we can with what we've got, and that's basically just follow up. So we'll call you and say, you know, you need to be in quarantine. We have a system called the Centra alert system. And if you're willing to give us that information, then you can give us your smartphone number, for example, and we'll text messages to you. You text messages back to us, doing okay, no fever, and that sort of thing. Otherwise, you know, we've got hundreds and hundreds of contacts that we're trying to keep up with on a day-by-day basis. The best we can do is spot checks, I guess is what I'm saying. And so we found that, fortunately, that same age group, the 20 to 29, are very receptive to the text messaging system. Some of of our older patients and our older contacts would rather just make telephone contact with us. And so if that's what they want, then that's what we're going to do.
And then my last question would just be for Dr. Lewis. The person you mentioned that passed over the weekend, two things. One, is this the person that you all had on the, I can't remember the device that we talked about last week at our press conference? And then two, how old is this person?
So Magdala, you always ask the probing questions. I can't, for patient confidentiality, tell you that detail in terms of what you're talking about as the ECMO, the extracorporeal membrane oxygenation machine. I can tell you my age is 47, so you can work backwards and figure it out. But that's what we were looking at.
Thank you.
Dr. Lewis, there's been numerous reports that talk about people healing different ailments, even COVID, when they have personal touch from relatives, friends. And we got some calls that the Centra is letting some folks come in to see relatives who are ill in other situations, not just COVID. Is that a tough sell as far as people who have the disease not being able to connect with their loved ones?
Right, so I'll try and, I guess, break that down a little bit. So in terms of healing with touch and that sort of thing, I don't have data on that. There isn't known data on that in terms of healing COVID. Unfortunately, there are very few data-proven things that help. We're working on more. We talked about remdesivir before. We've talked about steroids. Those seem to help. Now, your second question, or the second part, is complicated in that the visitation at Centra has, from the beginning, needed to become more drastic in terms of keeping folks that could potentially be infectious out of the hospital. And that, we understand, comes with a huge cost. I'm a physician. I know what it means to have family and loved ones care for you while you are in the hospital. It's an extremely scary time. It's difficult. We've had to balance that with the fear that bringing in, especially as COVID now is ravaging our community, bringing more COVID into the hospital and potentially cross-infecting other patients and other caregivers. We've done everything we could with electronic means, phone calls, linking, any which way we can, loved ones with their folks in the hospital. We've had to try and adapt to COVID, this new reality, and technology has been part of it. We would love to be able to open up our hospital again and have folks come back in. The way the community is going, I don't see that safely happening. We just have to reverse this. We have to slow this down.
And the governor has mentioned having these broad sources of equipment, PPE, masks, sanitizer equipment. How is the hospital doing in terms of equipment?
Right.
Supplies?
So currently, in terms of PPE and equipment, that's one thing we don't worry about horribly. Again, it's just the number of patients that we are running out of space. We're really, frankly, maxed out on space currently. We don't have a lot of room to go. And so, do we have enough ventilators? Yeah, we do. We still have over 100 ventilators. We're using a fraction of those. But it's just, how do you care for these large number of patients that are increasing by the day? And we do need to, so your PPE question really does relate to, can we protect our caregivers? We can. We have enough PPE. We have the masks we need. We have the shields we need, gowns, all of that. We've sorted that through. It's just the space.
There are recent reports that the cost of surgical gowns have gone up from 40 cents to $9. Is that something that Centra is seeing, and are you running into financial issues there?
Oh, so Santiago, I can't speak specifically to that. I was, early on, I was very involved with PPE when we were having shortages and concerns, and we did find flare-ups in the supply chain over time where prices just for some went out of control because they could. And whether that's moral, ethical, I'm not going to comment on. But in terms of whether we're having financial issues because of PPE, that I don't believe we are. I will tell you, though, that our CFO from the very beginning, and it impressed me quite a bit, said, don't worry about the cost, don't worry about the money, Just do what you need to do to take care of the patients. Let me worry about the money. And he's stuck with that since. And as a clinician, I respected that immensely.
And I have a question for Mayor Dolan. Is the city council pursuing any kinds of local mandates or regulations when it comes to gatherings or wearing masks? Any kind of ordinances you're pursuing?
We're just following the governor's recommendation in phase 3, basically.
Are you satisfied with his recommendations thus far, Your Honor?
Yes, I am. Except I probably wouldn't be opening the schools, but that's another issue.
And that was my next question. In terms of these numbers and the increase, what would you say to those who are still struggling with the issue of opening schools? We know that that's in the news and a lot of concern for a lot of parents and families.
Are you asking me?
All three of you.
Well, I think the important thing here is that we're looking at the safety of our children, so we need to do whatever that means. I'm just not convinced that we need to put kids back in school right now. You may have other thoughts about that, but I think given the data that we're hearing, I think that it's critical that we look at this very seriously.
So you're asking us all, so I guess. So I'll tell you, from a Centra standpoint, it's not our role to sort of say yes or no to school opening, but what I will say is that we have been reached out to and have reached out to schools when they ask about safety and how, if we are going to open, what's the safest way to do that? And I've been involved in some of those discussions. And what we have to make clear is that it's relative. You can't have absolute safety, especially with the way COVID is happening right now. The question is, how safe can you make it? What is the safest mechanism to open? And what are your protocols? Can you safely have kids and young adults distancing? Can you have them wearing masks? What does that look like? If you start having an infection in your school, what are your next moves? And those are things I think the schools are looking at, certainly in conversations, and thinking very deeply about. It's just hard to know where this will go. If the numbers keep going up, it just makes it more and more challenging to see how, the safety, it makes it more challenging.
I've been in regular communication with the superintendents of all the local school systems, some of private and all of the public school systems. We call each other pretty regularly to have this discussion. I'd like to bounce off something that was mentioned earlier and show how maybe focusing on one number is not the best thing to do. Yes, the number of cases that we've got is cumulative, but as an epidemiologist, I'm looking at that number. If you look at the VDH website, for example, there's a demographics tab, there's a locality tab. I'm looking at all those different numbers, and one of the most useful numbers, or graphs, if you will, to me is the daily case count. That's not the cumulative count, that's the daily case count. You can go to locality, go down and click on Central Virginia Health District, and it'll give you a graph that will show you that, for example, last Friday, we broke our record. We had 75 cases reported that day. The cumulative number is not going to tell you that those numbers are going up and up here in the last week or so. And so that's the number that, for example, is most concerning to the school superintendents that I have talked to. As far as the schools themselves, it's a very complicated decision. There's a lot of factors involved. Naturally, we tend to focus on the students. We tend to focus on the children. And that's appropriate. But when I'm talking with school boards and when I am talking with the superintendents, one of the questions that you have to ask is, what about your staff? What about your teachers? What about your bus drivers? I forget which school system I was talking to. I talked to 3 different ones last Friday, for example, but I said, how old are your bus drivers on average? And the answer was, well, they're retirees. A lot of them are retirees, 60, 65, 70. I said, and forgive me for being indelicate here, are any of them fat? And the answer was, a lot of them are fat. Do any of them have diabetes? A number of them have diabetes. Okay, that's a pretty high-risk category. You're in your mid to late 60s, you're overweight, you have diabetes, maybe some heart disease, some other risk factors. You know, the kids are coming on the bus, they may well be fine, but what about the bus driver? Same thing for teachers, particularly the teachers who are teaching the younger level students. The students may be fine, they may be infected and they may be fine. But if, particularly as we look at, kindergartners, first graders, children that age are very touchy-feely, exploring the world that way. They hug, and they expect hugs. And it's difficult not to respond to that desire for affection. But if you're an older teacher with risk factors, so on and so forth, and these first graders are not going to do great with their social distancing and the masks and even the hand washing and everything else, what kind of risk does that pose to the teacher as opposed to the students? So just to say it's a very complicated decision, you can look at some graphs and you can look at some numbers, but then there are a lot more factors that need to be taken into account as far as can we open the schools and can we open them safely for everyone that would be involved with that endeavor.
So I just want to add to that. I know that the superintendent and the school board is looking at this issue literally on a day-by-day basis. And I understand they're probably at a meeting tomorrow night to make further decisions on this. Nothing is set in concrete, I don't believe. Thank you.
And Dr. Beatley, is your guidance for churches and religious assembly the same as you're taking with schools? And if, a particular church or organization doesn't require their parishioners to wear masks, is there any kind of consequence that comes with that, or is that kind of up to their own discretion?
So far, that has just been a matter of discussion. Actually, haven't seen it happening a whole lot. Unfortunately, we have had some church-based outbreaks. It is likely that we have one going on now, but that hasn't been necessarily unusual. Again, we emphasize by the Phase 3 guidance that you are able to assemble as long as you are able to assemble more safely using the social distancing. Of course, we're encouraging the mask anytime that you are in that setting. But once again, the thing to remember is that the value of all of our infection control activities is additive. In other words, mask plus social distancing is better than mask alone. And so even if you've got a group meeting, a congregation meeting, and there's certain individuals in that group that are, for medical reasons, unable to wear a mask, let's say, well, let's still keep the social distancing and be all that much more careful about how we're crowding and so on and so forth. I would say that the great majority of the time, that's been the level of my interaction and my staff's interaction with churches and groups. And I think if they're not inclined to listen to us, then they're not going to be calling us. And a lot of them are calling us and asking our advice.
I have a follow-up question to the church comment. You were saying there's one going on right now. Can you be more detailed? Where is that church? Can you say the church's name if it is?
No. No, I can't provide that information. And as a matter of fact, that's still under investigation. A lot of times early on, particularly in an outbreak, as an epidemiologist, it's more of a putting two and two together. We've got two people with the same last name. This may be a family-related outbreak or something like that. And then we have to investigate those hunches and find out what's going on. So that's a hunch right now. It wouldn't be surprising, though. It would go along with everything else that we're hearing about what's going on in workplaces and in other places where people are assembling. The virus, again, personifying the thing, the virus takes advantage of every lapse. The virus takes advantage of every opportunity that people provide it to transmit itself. That's survival. And so when people relax, when they're a little bit careless with the mask, when they don't quite social distance like they should, gather in larger groups than they should, then it's not surprising, particularly with the community level of spread that we've got already, the virus will take advantage of that.
And my last question, I think could go for either one of you. For communities of color, how are you making sure that these people are, one, getting tested, because a lot of times they don't have the resources to get to a doctor, and how are you staying in touch with them? And what are the numbers like for when it's broken down by race?
One of the issues that we saw very early on that we've been working to fix is a lot of times the results that we get are a lab slip. And so somebody has ordered, a physician, for example, has ordered the test, and the only information on there may be a person's name and date of birth, for example. You're not going to have address, you're not going to have ethnicity, race information on that, because that's not part of filling out a lab form or lab requisition. So we have had to pay a lot more attention to trying to obtain that information and get that into our database. Particularly the data from the beginning, there are just a lot of cases we didn't have that information. We're trying harder to get that now. The staff that I have, I think, is actually quite diverse, and they are culturally sensitive, and realize that we're communicating in different ways. We always work out the best way to communicate with the individual. Would you like for us to call? Would you like us to text? How can we keep up with you? What it is you prefer? As far as the testing is presenting us in the medical community and public health community with a lot of challenges right now. You may have heard recently about the long turnaround times and the delays that we were experiencing. That seems to be improving in some cases for some labs. But I'm pleased to say that we have been working with Centra Health and several other partners to try to ramp up community testing events. And as of Friday, I received funding to do that. And so one of the things that I want to do today after this is get back in touch with Michael Elliott, the others that we've been working with, and start to see what we can do to make testing more available. What I have envisioned, rather than a located site, maybe drive-through requires you to have a car and all that sort of thing. Really, what I'm envisioning is lots of smaller scale testing events. Instead of one great big event where you have hundreds and hundreds of people showing up, going to a neighborhood community center, something like that, and just looking at walking distances, for example, and making the testing available on that. I'm excited to have that funding now and finally be able to carry out some of the plans that we've been making.
How much is that grant?
Close to $120,000 for Central Virginia.
Thank you. I think we need to wrap it up. These two men are two of the busiest men in Lynchburg, and I thank you very much for coming and giving your time and kind of educating us on all the aspects that we really need to know about and pay attention to, and thank you very much. And thank you all for coming. I'd like to recognize our former mayor and council member, Trinae Tweedy, who snuck in. Thank you. Thank you, everyone.